Okay, so we just want to take a brief moment to look at the differences between what overactive bladder and underactive bladder. When they say a bladder is overactive, what do they mean? When they say a bladder is underactive, what do they mean by this? Okay, so we'll be going step by step. We'll talk about the overactive bladder first. Let's talk about the underactive bladder. Combine the knowledge, you get to see the differences between the two concepts. Okay, so overactive bladder is a condition which is marked by what? A sudden urge to urinate and is difficult to control. Overactive, the bladder is overactive. Okay? Sudden need to urinate, difficult to control. So symptoms is there's urgency, there's intense urge to urinate, there's frequency, so you want to urinate very, very frequently within 24 hours. There's nocturia, you are waking up at night to urinate. There's urge incontinence. There's involuntary loss of urine following a strong urge to urinate. Okay. Then causes sometimes could be nerve damage from conditions like diabetes, stroke, multiple sclerosis, could be bladder muscle issues, hyperactivity of the muscles, could be urinary tract infections, could be medications that are taken that are affecting your bladder control. Okay. Treatment is behavioral therapy, bladder training, okay, pelvic floor exercise, lifestyle modification, and some medications like what anticholinergics or beta 3 adrenergic agonists just to relieve the bladder muscles, Botox injections, nerve stimulations. All of this will basically modulate the muscles, the nerves controlling the bladder. Okay. So the opposite condition which is underactive bladder now is also known as what detrusor underactivity. It's a condition where the bladder muscles cannot contract properly. So it will always lead to what? Incomplete bladder emptying. So you empty your bladder but it will not be completely emptied. So there's weak urine stream. Okay. So there's hesitancy, okay, difficulties starting urine. There's straining, which is you need to strain before you urinate. There's incomplete emptying. You feel like there's incomplete emptying of the bladder. Okay. So causes is sometimes nerve damage, muscle damage, medication. So some drugs that are taken will actually interfere with the bladder contractions. Treatment, you can actually give medication just to stimulate bladder contraction because the person be what? Suffering with contracting the bladder. So you want to give some medications that will stimulate bladder contraction. Bladder training, catheterization, surgery. So some cases surgery may be necessary just to remove what? Obstructions and also improve what? Bladder function. Right? So that's it. The difference between these two bladder conditions.